Hello, my name is Professor James Kingsland. I'm the clinical lead for the national programme, which we're calling the Complete Care Community Programme, a learning network focusing on reducing health inequalities. I'm delighted to welcome Dr. Bola Owolabi. Dr. Owolabi is a GP in the East Midlands, but most importantly for this programme is the Director for Health Inequalities at NHS England and NHS Improvement, formerly a National Specialty Advisor as well for older people and integrated person-centred care. So I'm delighted that she's going to give us the view, the national view of how health inequalities are going to be addressed by NHS England and NHS Improvement. We're looking at the NHS as the anchor organisation for the Complete Care Community Programme and the primary care networks as important starting point for this particular programme. So I'm delighted to welcome Dr. Bola Owolabi. Bola.
Thank you, James. It's a pleasure to be here and delighted to be working with you, James, and the Complete Care Community Programme. As James kindly introduced, I'm a practicing GP in the Midlands, and I also work as Health Inequalities Director at NHS England and Improvement. And I will say that actually tackling health inequalities is the golden thread through the course of my career as a GP, as a commissioning lead for children, young people and maternity, as a system lead for frailty and also for end-of-life care, and until very recently before starting in this portfolio as National Specialty Advisor to NHS England and Improvement for older people and integrated person-centered care. And so today I want to just talk you through what the work that we are doing, not just as a national team, but absolutely in collaboration with teams and networks and programs like the Complete Care Community Programme. And I've spent the first several weeks of being in post to speak with individuals and teams and organizations right across the country. And I believe that the vision statement that I'm sharing with you today is genuinely the voice of many people summarized into a statement. Our ambition is to work collectively to deliver exceptional quality healthcare for all being the important phrase, and to do that by ensuring equitable access and that people have an excellent experience once they've crossed the threshold, and that they have optimal outcomes from the care and the service that we provide to them. And when we talk about health inequalities, I am looking at a number of populations and looking at those communities through two particular lenses, which I will go on to talk about. We're looking at ethnic minority communities. We're looking at people in the most deprived communities in the country, those that we describe as the inclusion health group, so those experiencing homelessness, our traveler communities, those living with learning disability and or autism, people living with severe mental illness, of course, those with protected characteristics. And we're looking at them through the lenses of the wider determinants. So housing, employment, income, those big determinants in people's lives that make a significant contribution to their experience of health inequalities, and indeed through the lens of the life cause conditions, so maternity, cancer, cardiovascular disease, diabetes, obesity, and how these life conditions interact with the wider determinants in driving health inequalities amongst the communities that I've just been describing. And I say this within the context of the pandemic, that we have such a powerful legacy that we can leave behind us beyond this pandemic. Now, we look back to the experience of the last year and over, and we see how a harsh light has been shone on the health inequalities that have always existed within our communities, but which have been brought very much to the fore and have also been exacerbated and highlighted by the pandemic itself. And also, I am wanting to be clear that the Health Inequalities Improvement Programme within NHS England and Improvement is not going to be able to address the challenge of health inequalities in isolation. And this is where the contribution of the Complete Care Community Programme is incredibly important as a learning network, bringing together individuals and teams from the health and care sector right across the country to take forward tangible projects, and in so doing, starting to find solutions and answers to the complex challenges of health inequalities, and in such a way that we are able to scale and spread the learning from the network. So this is truly exciting to know that we will be able to take forward this work, not in isolation, but in collaboration and drawing on the creativity and the innovation that will be emerging from the complete care community as we go forward. In addition to that, there are a range of programs that I describe as enabling programs working alongside the National Health Inequalities Improvement Program to really make inroads in tackling health inequalities. You won't be surprised to see primary care in this list. And from the complete care community point of view, the primary care networks are a very important, central, and crucial contributor to this program and its success. Because, of course, they are anchors in their own rights within the communities where our communities live, where our people live, and where they experience the health inequalities that we've been talking about. Not forgetting the role of the integrated care systems. Again, another opportunity for us as the NHS to work in collaboration with health and well-being boards, with local authorities, with our voluntary sector partners in co-creating and finding solutions and ideas that work. And all of this is set within the context of the roles of the NHS in tackling health inequalities. So we know the NHS as a commissioner and provider of services is well placed to be able to leverage that role in ensuring equitable access, excellent experience, and optimal outcomes from the services that we provide. Secondly, the role of the NHS as a key partner within the integrated care system, as I was just describing. Indeed, the role of the NHS as an anchor institution, particularly as we address those wider determinants of health. And again, just reinforcing why the contribution of the PCNs to the Complete Care Community Programme is incredibly central and important. And finally, the role of the NHS as an employer, as we look after our own 1.3 million people employed in the NHS and addressing the health inequalities that they experience. So I'm delighted to see the important programs of work that are already underway through the Complete Care Community Programme. And I very much look forward to working with James and the team to continue to press forward and genuinely leave this legacy behind from this pandemic of narrowing health inequalities. Thank you.